How do I get my patient started on TYVASO DPI?
Hello, I'm Jordan Rice, a clinical trials research nurse at Houston Methodist Lung Center. Today, I'll be discussing strategies for helping set your patients up for success with TYVASO DPI, a first-of-its-kind dry powder inhaler indicated for the treatment of pulmonary arterial hypertension and pulmonary hypertension associated with interstitial lung disease to improve exercisability.
How is TYVASO DPI dosed?
TYVASO DPI uses single-use cartridges with a very small, portable inhaler. It comes in 4 different cartridge strengths: 16, 32, 48, and 64 micrograms. The cartridges are color-coded so it's easy for patients to recognize the dose they're on. Each cartridge needs just 1 breath, and taking it is as simple as open the inhaler, load with a fresh cartridge, closing it, and inhale. TYVASO DPI doses are taken 4 times a day, approximately 4 hours apart, when a patient's awake.
What is your approach for titrating TYVASO DPI?
The recommended starting dose of TYVASO DPI is 1 16 microgram cartridge 4 times daily. We increase the cartridge strength of the dose about every 1 to 2 weeks, depending on the tolerance of each patient. Our target maintenance dose is 48 to 64 micrograms 4 times daily, or patients can titrate higher as necessary, as directed by their healthcare provider. Titration schedules can vary from patient to patient. I emphasize to my patients to let their team know if they're having any side effects. Titration is always a team effort between patients and their care team. We want patients to get as much of the medication and have the least amount of side effects as possible. Additionally, I discuss strategies to help patients achieve their target dose. I strongly recommend that patients proactively treat any side effects. For example, if a patient is coughing, I suggest they take a cough drop 10 minutes before their dose.
How do you transition patients from TYVASO to TYVASO DPI?
Since TYVASO and TYVASO DPI are the same medication, we can transition TYVASO nebulizer users to TYVASO DPI by switching to the corresponding dose of TYVASO DPI. For example, 8 to 10 breaths of TYVASO are equivalent to 1 single breath of the 48 microgram cartridge of TYVASO DPI.
What other advice do you have for setting patients up for success on TYVASO DPI?
I have found the demonstration devices are extremely helpful for my patients. How do they put the cartridge in? How do they open and close the device? Another thing that's so important is keeping everything organized. Since TYVASO DPI is so portable, patients can carry TYVASO DPI and the day's cartridges together in their pocket or in a small carrying case while they're on the go. The great thing about TYVASO DPI blister packs is that the patients can tell when they've taken a dose and when they haven't yet. It's a great reminder.
What do I need to know to get my patients access to TYVASO DPI?
Getting access to TYVASO DPI is very similar to the traditional TYVASO nebulizer. They're on the same form and have the same referral process. TYVASO DPI is supplied in titration kits to help patients titrate to a target dose established by their care team. Maintenance kits are supplied as monthly refills once a patient hits their target maintenance dose.
You can find additional information about access on the United Therapeutics Cares website at www.unitedtherapeuticscares.com.
Do you have any final thoughts to share on TYVASO DPI?
I would emphasize that TYVASO DPI is a simple, portable device with convenient dosing for patients. As a nurse, I'm focused on my patients' ability to take their medications and how those medications fit into their lives. The portability of TYVASO DPI makes such a difference. It makes it easier for patients to go to work, to travel, to do all of their daily activities while being satisfied with the medication they're taking.
For additional resources and instructional videos for TYVASO DPI, please visit www.tyvasohcp.com. Important safety information. Indication: TYVASO, treprostinil inhalation solution, and TYVASO DPI, treprostinil inhalation powder, are prostacyclin mimetics indicated for the treatment of Pulmonary arterial hypertension, PAH-WHO Group 1, to improve exercise ability. Studies with TYVASO establishing effectiveness predominantly included patients with NYHA functional class 3 symptoms and etiologies of idiopathic or heritable PAH, 56%, or PAH associated with connective tissue diseases, 33%. The effects diminish over the minimum recommended dosing interval of 4 hours. Treatment timing can be adjusted for planned activities. While there are long-term data on use of treprostinil by other routes of administration, nearly all clinical experience with inhaled treprostinil has been on a background of an endothelin receptor antagonist, ERA, and/or a phosphodiesterase type 5 PDE5 inhibitor. The controlled clinical experience with TYVASO was limited to 12 weeks in duration. Pulmonary hypertension associated with interstitial lung disease, PH-ILD, WHO Group 3, to improve exercise ability. The study with TYVASO establishing effectiveness predominantly included patients with etiologies of idiopathic interstitial pneumonia, IIP 45%, inclusive of idiopathic pulmonary fibrosis, IPF, combined pulmonary fibrosis and emphysema, CPFE 25%, and WHO Group 3 connective tissue disease 22%. Important safety information, warnings, and precautions. TYVASO and TYVASO DPI are pulmonary and systemic vasodilators. In patients with low systemic arterial pressure, either product may produce symptomatic hypotension. Both products inhibit platelet aggregation and increase the risk of bleeding. Co-administration of a cytochrome P450 CYP2C8 enzyme inhibitor, for example gemfibrozil, may increase exposure, both Cmax and AUC, to treprostinil. Co-administration of a CYP2C8 enzyme inducer, for example rifampin, may decrease exposure to treprostinil. Increased exposure is likely to increase adverse events associated with treprostinil administration, whereas decreased exposure is likely to reduce clinical effectiveness. Like other inhaled prostaglandins, TYVASO and TYVASO DPI may cause acute bronchospasm. Patients with asthma or chronic obstructive pulmonary disease, COPD, or other bronchial hyperreactivity are at increased risk for bronchospasm. Ensure that such patients are treated optimally for reactive airway disease prior to and during treatment with TYVASO and TYVASO DPI. Drug interactions, specific populations. The concomitant use of either product with diuretics, antihypertensives, or other vasodilators may increase the risk of symptomatic hypotension. Human pharmacokinetic studies with an oral formulation of treprostinil diolamine, indicated that co-administration of the cytochrome P450 CYP2C8 enzyme inhibitor gemfibrozil increases exposure, both Cmax and AUC, to treprostinil. Co-administration of the CYP2C8 enzyme inducer rifampin decreases exposure to treprostinil. It is unclear if the safety and efficacy of treprostinil by the inhalation route are altered by inhibitors or inducers of CYP2C8. Limited case reports of treprostinil use in pregnant women are insufficient to inform a drug-associated risk of adverse developmental outcomes. However, pulmonary arterial hypertension is associated with an increased risk of maternal and fetal mortality. There are no data on the presence of treprostinil in human milk, the effects on the breastfed infant, or the effects on milk production. Safety and effectiveness in pediatric patients have not been established. Across clinical studies used to establish the effectiveness of TYVASO in patients with PAH and PH-ILD, 268, 47.8%, patients aged 65 years and over were enrolled. The treatment effects and safety profile observed in geriatric patients were similar to younger patients. In general, dose selection for an elderly patient should be cautious, reflecting the greater frequency of hepatic, renal, or cardiac dysfunction, and of concomitant diseases or other drug therapy. Adverse reactions. Pulmonary arterial hypertension, WHO Group 1. In a 12-week placebo-controlled study, TRIUMPH 1, of 235 patients with PAH, WHO Group 1, and nearly all NYHA functional class 3, the most common adverse reactions seen with TYVASO in 4% and more of PAH patients, and more than 3% greater than placebo, were cough, 54% versus 29%, headache, 41% versus 23%, throat irritation, pharyngolaryngеal pain, 25% versus 14%, nausea, 19% versus 11%, flushing, 15% versus less than 1%, and syncope, 6% versus less than 1%. In addition, adverse reactions occurring in 4% and more of patients were dizziness and diarrhea. In a 3-week open-label, single-sequence safety and tolerability study, BREEZE, conducted in 51 patients on stable doses of TYVASO, who switched to a corresponding dose of TYVASO DPI, the most commonly reported adverse events seen with TYVASO DPI in 4% and more of PAH patients during the 3-week treatment phase included cough, 35.3%, headache, 15.7%, dyspnea, 7.8%, and nausea, 5.9%. Pulmonary hypertension associated with ILD, WHO Group 3. In a 16-week placebo-controlled study, increase of 326 patients with PH-ILD, WHO Group 3. Adverse reactions with TYVASO were similar to the experience in studies of PAH. Please see full prescribing information for TYVASO or TYVASO DPI, instructions for use manuals for TD100 and TD300 TYVASO inhalation system and TYVASO DPI inhalation powder, and additional information at www.tyvasohcp.com or call 1-844-UNITHER, 1-844-864-8437. Please see full prescribing information at www.tyvasohcp.com. Thank you for watching.